This is Pet Life Radio. Let's talk pets.
Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds and grooming, to pet food, pet insurance, and dental care, this is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets, because it's your pet. Health matters. Please welcome your Pet Doctor host, veterinary media consultant and veterinarian, Dr. Bernadine Cruz.
You've likely heard of the medical condition known as diabetes. There are actually two forms of this condition, with diabetes mellitus being the most common type. It is also known as sugar diabetes. It was first diagnosed, or documented, I should say, in 1552 BC in an Egyptian papyrus. Diagnosis was made at the time by tasting the urine that was sweet. And I am so glad there is now more scientific ways to detect this disease. According to the CDC, it's estimated that it affects more than 100 million U.S. adults. Veterinary data has shown that 1 in every 300 dogs and 1 in 230 cats will develop diabetes during their lifetime. And the prevalence over the past 10 years is increasing. The diagnosis of diabetes is not a death sentence, but it is a condition that needs to be controlled and monitored, or else dire consequences can ensue. Dr. Richard Goldstein is the Vice President and Chief Medical Officer, Zoetis Global Diagnostics Medical Affairs. He's a board certified in small animal internal medicine by both the American College of Veterinary Internal Medicine and the European College of Veterinary Internal Medicine Companion Animals. Dr. Goldstein is active in the One Health community and serves on the scientific advisory boards of the One Health Commission. Very honored to have him today. We're going to be right back after this short break. Please stay tuned. Being a veterinarian is not all fuzzy kittens and cuddly puppies. There are a lot of stinky things I have to contend with, many of which get on me. There are times I know I must reek like a litter box when I leave the office. And if you have a cat like me, you know that nothing smells worse than a wet litter box. Luckily, Arm & Hammer has a solution. New Absorbix cat litter made with desert dry minerals. It absorbs wetness in seconds, taking that wet odor out of the picture. Go to armandhammer.com/bounty and get $4 off your box of quick absorbing Absorbix and have a nice, dry, unstinky day. New Absorbix from Arm & Hammer. More power to you.
Let's Talk Pets on PetLifeRadio.com.
Dr. Goldstein, thank you so much for being a guest. This is a condition that I see, sadly, way too often in my practice.
Yeah, I think everyone does. You know, it is the number one endocrine disease in dogs. It's probably the number two endocrine disease in cats. And it is really common. And as you said in the introduction, it's very manageable, but it has to be diagnosed and managed appropriately. Or, as you said, dire consequences can occur, and they actually do.
Well, I think so many people are familiar with diabetes. They've heard of it, probably have a family member, a friend, somebody who's had the disease. And oftentimes people say, oh yeah, I know all about diabetes. A family member has it. Is diabetes in pets really the same as diabetes in animals?
I mean, the bottom line is yes, in terms of being a lack of or relative lack of insulin in terms of its ability to enable glucose into the cells. So all of our cells use glucose to derive energy from, and that glucose has to get into the cells from our bloodstream to be able to do that. And insulin opens up these transporters for glucose to get into the cells. So when there's either not enough insulin or the insulin doesn't work, glucose stays in the blood. It's high in the blood, but that doesn't help us because it's not in the cells where it actually needs to be. And so that is the bottom line for all diabetes. There are different kinds of people and there are different kinds of animals. And I'm happy to talk about that if you'd like as well.
Sure, because I know people have heard of, type 1 diabetes, type 2 diabetes. Now, do pets, typically people say, oh yeah, well, I'm a diabetic, I'm a type 2 diabetic, and I just control my diabetes by what I eat. So, my pets are going to be the same way. Not true, correct?
Usually not true. So type 1 diabetes, or in people sometimes called juvenile diabetes, is a relative lack or complete lack of insulin. It's usually an autoimmune disease of the endocrine pancreas where the insulin is produced, and there just isn't enough insulin. And really the only treatment in both people and animals is insulin. That is the most common kind of diabetes in kids and young adults, and that is the most common kind by far of diabetes in dogs. What older adults can get is type 2 diabetes, which is a phenomenon of insulin resistance. So even though insulin is there, maybe not enough, but it is there, it doesn't work as well because the cells become resistant to the function of insulin. And that is, again, in older people, the most common type of diabetes. That's that type 2 that can be managed sometimes with diet and exercise. And that is the most common type of diabetes in cats. So cats type 2, dogs type 1. The unfortunate part, and this is where your question is absolutely correct, even though it happens in cats similar to people, most cats cannot be managed, at least long term, on diet alone. Diet does help, and often initially they can be managed well with diet without insulin, but eventually most cats will require insulin, even though they are officially type 2 diabetics.
Cats always have to be difficult, don't they?
Yes.
All right. One of the signs people bring in a cat, and I agree, I see more diabetic cats than I do dogs. And their sign will be, I think it has a bladder infection because it's just drinking water like crazy and it's losing weight. So it must be that new cat food that I'm feeding because it used to be a fat cat and now it's slimming down. And all of a sudden these alarm bells are going off in my mind. What are the signs that a pet owner should look for that your pet might be a diabetic cat, a diabetic dog?
Yeah, it was just that cat, and dogs would be very similar. So it's increased drinking and urination, and often in cats, it's the urination that's noticed because the litter box is all of a sudden floating in urine. And often in dogs, it's more the drinking that's noticed because they just keep drinking in a very visible way. So increased drinking and urination, increased appetite, but despite eating more, they do lose weight, as you suggested. So increased drinking, increased urination, increased appetite with weight loss are the hallmarks of diabetes. And that's true in people as well, especially with type 1 or juvenile diabetes.
And so many times I think it's hard for people when they have multiple pets in a household, especially cats, because they tend to be rather covert in their activities. So you've never really noticed your cat drinking water. You know it does because it urinates and, there's pee in the box. But it's all of a sudden you go, whoa, this cat is jumping up onto the kitchen sink whenever I turn on the faucet, or it's hanging its head in the toilet pretending it's a dog, drinking water that way. So it can be a change of something you've never seen before, but now it's like, what's happening? Or as you were saying, Dr. Goldstein, having that cat box, even having multiple cats, you may not be aware of who's doing what, but the size of the urine balls, especially if you're using a clumping litter, become huge.
Yeah. And, hopefully we recognize these diseases early in cats and dogs, and by being aware of their normal behavior, just as you suggested, and then being aware of that when that changes, right? So if you're not used to seeing your cat drink, it does sometimes, but, if it eats wet food, it probably doesn't drink a lot anyway. And then all of a sudden you do notice a drink, even that doesn't seem to be excessive. That's a change. And one of the things we're really trying to impress upon people is know your animal's normal behavior. Know what they typically do. If you have a female dog and she usually goes out and pees once and now it's taking her longer to pee, or she's peeing multiple times outside, that's not normal. So know what is normal for your pet. And then when there's abnormal things, even if they're somewhat subtle, you can bring that to the attention of your veterinarian. Again, ideally, we would always catch it at that point. Sometimes we don't, though. And all of a sudden, you're living with these pets, and so you don't notice kind of a gradual weight loss. But then, the kids come back from college or someone comes over and say, your cat's really skinny, and you notice it then. But even better than all of that, if you don't notice these small changes at home, is regular checkups with your veterinarian, right? If you're going to your veterinarian regularly and your pets are being weighed and they're getting blood tests and they're being looked at, that's another mechanism besides just the changes in the clinical signs to pick things up early, even maybe before the clinical signs are obvious. I would hate to find out after a cat lost 2 pounds of weight and has been polyuric and polydipsic or drinking a lot and urinating a lot for months. It would be a shame to find it out then. Let's find it out early by knowing their normal behavior, recognizing small changes, and then taking the animals to your vet frequently so they can be monitored closely, just like we do with our own health.
Dr. Goldstein, I cannot agree with you more. So many times, people bring in, and cats, I have two, and I know they do not like going with me to the office for their yearly exams, but I trundle them up. So even though I'm a veterinarian, I see them at home every day, I still like to take them in so they can get their full physical, just kind of different when they're there at the hospital with me, and getting their blood work and getting their weight taken and making sure that everything's okay, because they are so good at hiding their signs of illness. And many times, sadly, people say, oh yeah, last time I saw the vet was when it was a kitten, and now it's 10 years of age and has all these medical issues that are so much more difficult to get under control and a lot more expensive to get under control too.
Yes. And that, and again, that speaks to the value of preventative medicine and wellness. And in this case, that can be, this is the extreme case of that. So when diabetics go uncontrolled for an extended period of time and then something else happens, so they get a bladder infection or they get pancreatitis, which is an inflammation of the pancreas, which can accompany often diabetes, they can actually become very, very sick. And they'll go into a status that's called diabetic ketoacidosis, which is the kind of a spiraling down of uncontrolled diabetes where the body is so hungered for energy, it starts taking apart fat. And, many of us think of that as a good thing. But in the extreme like this, it makes them very, very sick. And to the point where it is fatal and up to 50% of cats. And so preventing that by getting this diagnosis early and getting them on insulin or on at least a good routine management is really crucially important.
Dr. Goldstein, you were mentioning ketosis, and I'm sure a lot of people have heard, as you're saying, boy, it seems like a good thing you're breaking down that fat as an energy source and you're slimming down the keto diet, but that's a really controlled phenomena versus in cats and dogs with this diabetes, it's not. So besides death, what are some of the other long-term side effects that a diabetic cat or dog can experience?
That's actually a really interesting question because it's almost as interesting to say what they don't experience. And so, in people, and this is one of the big advantages to there's many advantages to being a dog or a cat, and this is one of them. Dogs and cats don't get the same long-term side effects that people do from diabetes. So in people, diabetes is a very, very common cause of vascular disease. We know that it results often in multiple amputations. In diabetics that are not well controlled, it's a very common cause of kidney disease. It results often in dialysis and renal transplant. And it's a very, very common cause of heart disease. None of that happens. Even the neuropathies or the neurologic consequences of diabetes in pets is relatively minor compared to people. So we don't often see those long-term side effects, which is a good thing because that is one of the reasons that we are able to manage cats and dogs in the way we can. And we'll talk about that, I think, in a little bit, if you'd like, about how the difference in management and the difference in expectations really is different. This is not as life-changing as many people would think based on their familiarity with human diabetes and how that's managed with insulin when we're talking about managing dogs and cats. So we can talk about that as well. But if the diabetes is not controlled, they will continue to lose weight. They'll become very thin, very weak, and they will eventually develop this diabetic ketoacidosis and die from their diabetes down the road. So it's not a good thing to obviously to ignore. We have to treat it. Luckily, we can treat it in a way that's much more conducive to a good quality of life for diabetic dogs and cats without the kind of very, very intense regulation that's required in people, where people have to check their insulin before every meal and give themselves multiple injections during the day to keep the insulin very, very tightly controlled. We don't need as tight of a control in dogs and cats, luckily.
And I think that is so important for people to realize, because the number of times I've told someone, oh, well, your dog's a diabetic, and they give me this look like, all right, doc, just euthanize it now. It's like, no. It's just a diabetic. We can control this. There's ways that we can do this. It's not that hard. You don't give up your life of having to be home exactly at the particular hour to do this. We can do this together. So I can't stand injections. And I'd love to have you talk about that. Is that the only way that diabetes, you're saying that even though cats are more like a type 2 and a type 2 for a person is going to regulate themselves with diet, cats and dogs both need insulin. So how are these insulin injections, I gave it away. Insulin is given via injection. Is that the only way they can get it?
That's the only current way. Maybe one day we'll have other options, but the only current way is with injections. And some cats, as I said before, shortly after diagnosis can be turned around on diet. but it usually doesn't last very long. And so ultimately, they all will need insulin. For cats, we have insulins. Dogs and cats are really a little bit different in the type of insulin we typically use. But some cats can be managed on once a day. Most cats and all dogs need to be managed on twice a day insulin. So 2 injections a day. Again, not the every few hours kind of thing that like we do in people. And you're right. People are often very, very afraid of that. They're afraid of never going to be able to go on vacation again and never going to be able to go out to dinner. And they're also afraid of needles and giving injections. And that's one of the things that we have to overcome, because we don't want people to euthanize animals just because they're diabetic. That they can live a perfectly long and happy life as diabetics. And in reality, it's a lot easier to give an injection than to pill a cat, right? So
that's an understatement.
Yeah, we teach people how to do it. We have them practice on oranges and on bags of fluid and then on the animal themselves. And everybody can do it. There has rarely been a person that I've dealt with in my 20-some years as being a veterinarian who could not give insulin. You teach them how to roll the bottle gently, how to pull the insulin out of the bottle, how to give the correct amount. That's also a big deal. They need to give the correct amount, not more and not less. And then under the skin injection. They don't have to give it into the muscle. It's just under the skin. And it's typically twice a day. And the animals get used to it. The people get used to it. And it becomes a routine that is really not a big deal. So you're right. The initial reaction, horrible. I can't do it. A lot of coaching and talking and a team. As you said, we will get through this together. The team is really important. I think that, and probably the most important member of this team, besides the animal, besides the dog or cat and the owner, is a veterinary technician. The veterinary technicians are typically the ones who will spend the time teaching the owners, dealing with their anxieties, managing the coaching through the how to give injections and where to give injections, how to draw up the insulin. And so I would recommend that every veterinarian in their practice have technicians who are really skilled at giving that talk, giving that spiel, if you will, and doing those teachings. There's obviously many videos online now on how to do it as well. And that person becomes a true team member with the owner, with the cat, and with the veterinarian in managing the diabetes together. And it works. The fact is it works. And, all you have to do is look at the Facebook groups around diabetic cats and dogs and the hundreds of testimonies, 1,000 testimonies about how successful it can be with a little bit of effort initially and then really minimal effort down the road.
Well, Dr. Goldstein, this is fabulous. And yes, so many people are afraid. And I think this is the point of our conversation where we need to take a short little break, be right back, maybe talk a little bit more about giving those injections and how animals can really handle it, and then ways that we can monitor these pets at home. We'll be right back after the short break.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
For those fortunate to have experienced the deep bond and unconditional love of a companion animal, the death that follows can be one of the most difficult and misunderstood losses to go through. Many times, this devastating loss goes unrecognized and trivialized by family and friends, leaving grieving pet parents struggling to find healthy ways to cope with the loss. In And I Love You Still, a thoughtful guide and remembrance journal for healing the loss of a pet, Dr. Julianne Corbin calls attention to the difficulties unique to the loss of a beloved pet and provides an interactive and compassionate guide to help you process your loss and work towards coming to a place of peace and healing. For those interested in journal therapy and looking for a professionally written and compassionate resource to help understand and reconcile the grief associated with the loss of your pet, this book is for you. And I Love You Still, a thoughtful guide and remembrance journal by Julianne Corbin, is now available for purchase on Amazon and other major book retailers.
Looking for a dental treat that does more for your dog? Daily Dose is a 2-in-1 chew that pairs a daily dental scrub with powerful supplements to help with the biggest health concerns facing our dogs. Daily Dose was developed by vets to be simple to use and super effective. Plus, dogs love the taste. Available for joint, skin, heart health, or calming. Daily Dose. Your pet's daily dose of awesome. Visit yourpetsdailydose.com to save $3 on your first bag with promo code PETLIFE. That's yourpetsdailydose.com.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to the Pet Doctor on Pet Life Radio. The doctor is in, and we'll see you now.
Well, Dr. Goldstein, we're just going to have to listen to this truck in the background because, yes, we're all working from home, and this truck has decided it wants to park itself in front of my condominium right now. So I think one of the most important things that you've said is that you are still able to have a life even though your pet has diabetes, is going to need these insulin injections twice a day. So it doesn't have to be every 12 hours exactly, correct?
No, it doesn't. And I'm not saying that I recommend this, but if you miss a dose, that's also not the end of the world in an otherwise, healthy diabetic. It's definitely doable. And I think it's our role as veterinarians to be able to kind of mold the treatment schedules around people's lives. So if it's, 6 a.m. and 10 p.m.-ish, that's okay. If they're out all day, they don't need to come home in the middle of the day. If it's, 10 p.m., they get to sleep in, and 8 p.m., that's also okay. We can manage diabetes on multiple schedules with multiple diets. Dogs and cats often have other issues. They're allergic to this or allergic to that. We can manage it with multiple diets, with multiple schedules, with multiple types of insulin. Again, it's a little bit of an intensive effort up front to get them regulated, and then we kind of back off and they let them live their lives. And that's the goal, right? When we think of what are the goals of treatment, in people, because of those side effects that I talked about, because we know that if the glucose in people isn't really tightly controlled around normal, they will have those long-term effects of cardiac disease and renal disease and vascular disease. Because we know dogs and cats won't get that, we can be much more liberal, if you will, about how we manage the diabetes. And our goal is for them to be happy. We want them to have normal energy. We want them to drink and eat normal amounts. We want them to not lose weight. And we want them to have good quality of life. And we can do that, again, with twice-a-day injections. We allow the blood glucose to go up in the morning before the injection, down towards normal in the middle of the day, and then up again in the evening before the injection. But that's okay because that won't cause those long-term effects. And so the question we ask ourselves is, if a diabetic cat or dog, the most important question to ask when you're looking at how controlled they are is, how are they behaving? How is their weight? If they're happy and their weight is stable, chances are 99% of the time they're good. We don't even have to look at insulin or glucose. We do look at glucose because we want to verify things, but good quality of life is our goal, and we're able to achieve that almost in every diabetic dog and cat.
I love your philosophy for diabetes because there are so many times, especially with diabetic cats who don't like coming to the hospital, they get in that car ride, their blood sugar goes up because they're scared, a normal reaction in their little bodies. It's like, all right, stay home. Tell me, what's, the cat drinking? Is it drinking more, less, about the same? Oh, it's drinking less. Perfect. We're on the right track here. What are the size of the urine balls? How often is your pet asking to go outside? Less? Perfect. This is fabulous. So all of those clinical signs of it's putting on weight, its coat looks better, it has more energy. You're exactly right. Those are the things that I want people to watch. Oftentimes people want to know because they've heard of people with diabetes, their friends or themselves, and they're monitoring their A1C. Is that something that's typically done in dogs and cats?
It can be done, and we also have a similar thing that we do more often called fructosamine, and those are long-term measurements of glycemic control. They can be done, and especially fructosamine, they're helpful in the beginning until we get them regulated. Another thing, though, and I completely agree with your cat story that doesn't want to go to the hospital. The other thing is, though, we can do blood glucoses at home. So, when I was first trained in endocrinology in the mid-90s, in those days, a lot of people were still doing what we call glucose curves, which is bringing cats into the hospital and doing them in the hospital, taking glucose measurement every hour or two and trying to figure out how well the cats are regulated, especially in those cases where they weren't doing great at home. So the answer to all those questions was not yes. Okay, now we have to look more closely. Let's bring the cat into the hospital and let's do that glucose curve, 6 times over 12 hours, look at the glucose and see what's happening. But more times out of 9, you're correct, it would be sky high the whole day. They'd be so stressed, cowered in the back of the cage, it would be sky high the whole day and the data would be meaningless and we couldn't act on it. So what we've really developed in the last few years and has become more and more common is doing those curves at home. So when we do need to know what the glucose is, people are able to draw blood at home, use glucose monitors at home, and share that information with the veterinarian. That's something that we at Zoetis and we as internal medicine veterinarians really, really stress. Get the information, get the data at home when the cat is relaxed, and then don't act on it on your own. Please share that information with your veterinarian and then make decisions together whether the insulin regimen needs to be changed or not. But glucose monitoring at home has really revolutionized many cat and owners' lives. You don't have to try to chase them out from under the bed to get them to the carrier, bring them to the vet for a useless day of high blood glucoses. Just do it at home on the couch where they're happy. It's easy to teach. People love doing it because they get a sense of confidence that they can check and make sure the glucose isn't out of control. And they can also make sure it's not too low. Low glucoses are probably worse than high glucoses because cats and dogs and people can lose consciousness, can seizure, can even die from a really low glucose. So, you gave the insulin, then the cat vomited a few times, lost its dinner. Maybe you gave too much or something else happened and you're worried the glucose is low. Be set up to monitor glucose at home. You check the glucose, it's fine, you're good. If it's low, then you know what to do. You give it some kind of sugar solution to bring that glucose up. So many of these issues can be managed and should be managed at home. And it is really revolutionizing people's lives to do these glucose monitoring at home versus trying to bring them into the vet for it.
I know a lot of people are using, and one that I've had the most success with is one called Alpha Track. It's carried by Zoetis.
Yes, sure.
And it is amazing where you can do it from the ear, you can do it from a toe, but it's kind of thinking of, a human child going, oh my goodness, they have to poke themselves, in order to see what their blood sugar is multiple times a day. You don't do it all the time, just periodically. And your pets really do forgive you and just kind of like, whatever, let's go on with life.
Yeah, that is a product, that I really love being able to support and call ours. It's a product that does allow that freedom of people to really feel happy and confident that they can take control over the care of their diabetic animals and know at 2 a.m. if they wake up anxious because the cat seems a little bit sleepier, they can do a blood glucose and find out that it's fine and go back to sleep. It really does help cats and dogs and their owners live a much happier life. So it's a wonderful product, and I'm very pleased that it's out there and that people use it.
Dr. Goldstein, I'd love to have you also chat about something I've started using in practice, and it was a board-certified internist referral practice that I had sent this particular kitty over to because I was having a very difficult time trying to control the diabetes, and we were just in the early stages of this control. She was recommending an interstitial glucose monitor. And I had honestly, and I go to a fair amount of CE, continuing education, I had never heard of this. And then after learning about going, oh, this is marvelous. And it worked really nicely. So the Alpha Track that we were talking about, the glucose monitor, is a little bit of blood that you're looking at for blood sugar. But this is kind of the sugar between the cells. Can you discuss a little bit about the interstitial glucose monitors, how they're working, and if it's catching on in veterinary medicine?
Yeah, and I think it is. So these are human monitors, right? So Alpha Track is actually a specific monitor for dogs and cats. And things are a little bit different between people and dogs and cats. And so, we take a lot of care with Alpha Track to make sure it's specifically monitoring cat glucose and the way cat glucose should be monitored. So using human monitors is also okay. It's not going to be as accurate in terms of the absolute numbers, but the trends are what's important sometimes in those early stages. And that's what you can get with these interstitial devices. So it's a patch. Again, not ideal because, human skin and cat skin with all the fur is different, but there's ways around that. You can use it for a few days or up to a week or two and get, readings of glucose without having to stick the animal every time. Useful in the beginning, as you suggested, sometimes when things are relatively intense, you don't want to use that, long term because you would have to change them out all the time and you don't really need that and the cats don't like to have that patch on them. But it is helpful in the initial stages and it's becoming in vogue in the specialist practices. Again, I don't think it's ever going to take over the kind of the popularity of routine monitoring at home until we have devices like that are specific for cats and dogs and are really tailored for cats and dogs versus the human ones. But it's definitely an interesting trend, and it's the way human monitoring is going. People don't like to stick themselves to get their blood glucose. People will stick themselves in the fingers, and it's really painful. We have much better success in sticking dogs and cats. But that is the trend in human medicine, and we will likely get there one day in veterinary medicine. We're just not there yet with a specific dog or cat monitor that can be used without blood.
It was fascinating to watch because I've gotten away from doing the glucose curves, as you were mentioning, just the expense, the discomfort for the pet, the data being somewhat questionable, and having the Alpha Track is marvelous that people can use at home. For those that pets or the people going, no, I just don't think I want to do that. This monitoring device, the interstitial monitor, was so fascinating because they were just using technology. They were just using their phone to scan, get the numbers. They could then send it to me as an email and I could look at and see the trends. And it's like, we fine-tuned this particular kitty and now the cat is thankfully under control and really doing well.
Yeah. And it's funny, even with Alpha Track, people are, just like with injections, they're often very resistant. But then once they realize that the cats don't mind, and once they realize kind of the satisfaction of getting that information, often we have the challenge of getting them to stop. We don't need to do it every day, 3 times a day, 4 times a day, but people get into that rhythm and that habit, and then we'll just do it. We do recommend keeping logs. They keep logs of what the dogs and cats eat, keeping how much they eat, when they eat, keep logs of if you do measure glucose at home, keep logs of other abnormal things like vomiting or other activities, so that we can look back when you go to the veterinarian and look and see what's happened in the past few weeks or so. But yeah, I think that the overall, and this may be true for other areas of veterinary medicine as well, especially these days when everyone's spending more time at home. I think that the transition from trying to do everything at the vet office in hospitalized patients versus doing more things at home and providing that data to the veterinarian is going to be the way we're going in the future.
Pets definitely love it, and so do the owners too. I love how you were talking about diet, and this seems the largest areas of controversy, at least among the boarded internists that I've chatted with, especially cats. Feeding a diabetic dog, okay, typically dogs are eating twice a day, so you have them eat a little bit right before you give the injection. But now you have a cat that is typically one that likes to nosh or snack throughout the day. And do you put a cat on a specific feeding regimen twice a day? How do you feed a cat? What do you recommend for feeding cats?
So I think, and the way I've always felt is, we need to make this manageable for the people and for the cat. Yes, we could say that studies show that if they eat exactly this diet at exactly this time, there's a 3% better chance of them living, 2 months longer than if they don't. But that might not be okay for that person or for that cat. And they may be just happier continuing to live their life as they've lived it. So I think that it makes sense to try to move to 2 meals, at least for part of the diet. And canned food can help with that. The cat diabetes diets, or what we can call the catkins diets these days, are very palatable. And so often cats will like to eat them and then let them nosh throughout the day. That's fine. Again, we don't need to be that hyper vigilant about exactly what their blood glucose is. As long as it's not low and it's not super high and it comes down to a reasonable number after giving insulin, we're okay. So I've always felt like, let's hear what their daily routine is. If we can make some minor changes to make it more reliable. And the only reason I like to feed meals is I like to know they're eating before I give the insulin, right? So I don't want to give the insulin and for them to not eat for the next 24 hours. And then maybe that was too much insulin. So I like to see them eating. Then they get their insulin. Then they can nosh all they want. In the evening, I'll watch them eating again a little bit. Then they can get their insulin again. So tailor the routine to the lifestyle of the cat. And again, in multi-cat households, sometimes you just can't. I mean, you can tell people to close their cats off in different rooms, and then everybody's screaming, and who wants that? So listen to what the cat's doing now. Often these are older cats. They're very set in their ways. And then I do believe that we as veterinarians can tailor and find an optimal solution accommodating the cat's lifestyle.
Quality of life is so important. Quantity, we all want so much time with our pets, but having that quality makes a difference. That's what we need.
Yeah, agreed.
And one of the things I always tell people to watch for too, whenever I have, that new diabetic, they get a conversation from me. They definitely have it from my nurse. They go through, they practice, they come back in about a week or two later. We have them bring the insulin, the food, show us how you're doing this. I always tell them, and I learned this the hard way, make sure you use a new needle and syringe for each injection. I had a client that could not control their diabetic dog. And, we kept asking it, kept doing these, it just couldn't figure it out. I said, okay, let's start all over again. Bring in everything. Show me what you're doing. She agitated the bottle correctly. She drew it up correctly. She gave it correctly. And then I said, okay, give me the syringe. I'm going to throw it away for you. She says, but I want it back. It's like, why do you want it back? Because I clean it. You do? And how do you clean it? Oh, I run alcohol through it and then use it again. No, don't do that. You are going to denature the insulin. It's meant for a one-time use. They're not that expensive. Make sure you dispose of these syringes properly. The insulin itself oftentimes will go bad by the time you're getting to the end of that bottle. Sometimes you can't use a whole bottle. You might need to, depend on how much your pet gets, maybe half or 3/4 of the way through that bottle, get another one because it will start to denature. It'll start to go bad. Have a little honey bear. I always wanted as a kid, my mom would never buy honey in those little cute plastic bear-shaped bottles with a little pointy hat. Those are perfect to have on hand in case your pet seems to be just flat out. Is this low blood sugar? What's going on? Before you try to figure out, put that honey bear in its mouth, give it a big swallow of honey. Even if they don't swallow it or a big glump of push of that honey into the mouth, it'll get absorbed through their little mucous membranes, then get to your veterinarian or to the emergency clinic. And especially for cats, watch the way they're walking. A normal cat is going to be basically walking on its toes. And if you notice your cat being somewhat flat-footed in the back, so it's kind of walking on its heels, those can be indications that diabetic control is not what you need it to be. See your veterinarian.
Yeah, I totally agree. And I think that having them, what you did was really important. Having them bring the insulin in and watching them giving it is really important because you do pick up things that, when you question them, you'll never pick it up. One of the other things that happens sometimes is people, especially if they're using human insulin, if they're not sure what insulin they're using, insulin is over the counter at pharmacies. And so you can just walk into a pharmacy and ask for insulin because if not, it would be just too difficult for human diabetics to manage prescriptions all the time. And often pharmacists will be out of one insulin and give another one, and they think it's probably fine, and it's very different, including major differences in potency, et cetera. And so just ask them to bring in their insulin in a little cold pack when they come in for the visit is important, or take a picture of it because it happens more often than not. Then animal ends up on an insulin that was not prescribed, and maybe it's fine, maybe it's not, but we'll never know it unless we look at it. So I think that's a really good practice to have, is to have them show you how they're giving the injection. They're not giving it in the fur. They're not giving it in the thumb. They're handling the insulin properly, and it actually is the correct insulin and the correct amount.
Dr. Goldstein, is there any last words of wisdom where people should go if they need more information on diabetes besides their regular veterinarian?
Well, we definitely have a lot of information on alphatrack.com. Also on the Zoetis website and the veterinarian. I would not go to Google. I would not go to social media unless you know exactly who you're talking to. But you can definitely trust the Zoetis websites, AlphaTrack, as well as your veterinarian. And my advice would be just kind of the way what we said in the beginning. Pay attention to your animals now when they're young and when they're healthy. Be very aware of those little things that, like drinking a little bit more or peeing a little bit more. And then if you do have an animal that's diagnosed with diabetes, that is not a death sentence. Just be patient, give it a little bit of time, and you'll be amazed at how good of a life they can have and how normal of a life they can have and be with you for many years. So it's a team effort. It's you and the cat or dog and the veterinarian and the veterinary technician all working together. But together, amazing things can happen. And there's way worse things in the world today. So no one wants to have a diabetic pet, but if you do, it'll be okay. And people actually even adopt diabetic pets from shelters. It's not a death sentence. It's easily managed. Monitoring is easily done at home these days. And so, we're kind of turning the page on a disease that we would have thought would be just horrible even just a few years ago.
Better living through technology. Thank you to Zoetis for bringing some great products to market. I've had the honor of speaking with Dr. Richard Goldstein, Vice President and Chief Medical Officer, Zoetis Global Diagnostics Medical Affairs. Again, Dr. Goldstein, thank you so much for being with us today. Some great, fabulous information.
Thank you for having me. Thanks so much.
This is Dr. Bernadine Cruz. You've been listening to The Pet Doctor on Pet Life Radio. Please tune in again next week. We'll give you more information on how to make you that best possible pet owner. Thanks so much for listening.
Pets can be a wonderful addition to your life because they're a member of the family. Keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. The Pet Doctor, on demand every week, only on PetLifeRadio.com.